So did you ever wonder what it would be like to be a grandparent at a very early age? Well, about 37,525 Texans know the answer to this question because they had a teenager who had an unplanned pregnancy and made them into grandparents much earlier than they expected. This is a statistic by the National Campaign to Prevent Teen and Unplanned Pregnancy. The Centers for Disease Control and Prevention also reports that the United States has the highest teenage pregnancy rates in all of the civilized world. The cost of teen childbearing in the United States is about $9.5 billion every year. So we have a problem. We have a problem in the United States, and that is that we have teenage pregnancy rates at an astounding high. And it's costing us billions of dollars every year. Why? Because teenagers don't have all the information and they don't have all the resources necessary in order to make better decisions regarding the sexual activity that they're involved in. So what's the solution? How do we fix it? Well, we fix it by having better communication with them. And that means having a more aggressive, a better quality sex education program in high school. So quality sex education in schools have proven to be very successful in reducing the teenage pregnancy rate. So what is a quality sex education program? Well, for starters, it's not just a conversation about sex. Obviously, it includes that conversation, but it goes further than that. It goes beyond that, and it talks about the risks associated with this type of activity. It talks about contraceptives. It talks about different methods that they can use to protect themselves. It talks about how their body works. It talks about their physical well-being, their mental well-being, their nutritional choices. All of those things encompass a very healthy human being that can allow them to make better decisions once they know what their life is supposed to be like, what choices they're supposed to make. When they know how their body works, when they know everything that is involved in living a healthy lifestyle, they'll make better choices. One of the other things that we talked about is the risks associated. Definitely, that's a concern as well. The American Academy of Child and Adolescent Psychiatry reports that there's about 3 million teenagers that get sexually transmitted diseases every year. Teenagers need to know what risks they have. They need to know how their body works. We need to quit tiptoeing around the fact that teenagers are having sex. Humans are sexual beings. It happens. We need to have a conversation with them and let them know how they can prevent things, unplanned pregnancies from happening, diseases from being gotten from this type of activity. We need to have that conversation with them and give them the information necessary so that they know how to protect themselves. Quality sex education also includes knowing the different types of birth control methods that are out there and which is the best one for them to use. We need to give them access to contraceptives. Again, they're having sex. We know that this is happening because the numbers support it. We have an astoundingly high rate of unplanned teenage pregnancy. So let's get them the information they need. According to Planned Parenthood, there are many safe and affordable birth control methods that can be discussed privately with them so that they know what is the best choice for them. Healthcare providers are also being more aggressive and taking more of an initiative to discuss these things, talk to them about sex and contraceptives when they're just coming in for regular checkups. Parents are being bypassed. The information is simply being put out there so that they have the information necessary, and if they want to have a discussion with them, they can, with parents present or with them by themselves. It's information that is being made available to them. Parents and community alike are going to need to be involved in order for this to be successful. So the U.S. Department of Health and Human Services is being proactive in this initiative and sponsoring a pregnancy assistance fund. This fund is aimed at teenagers who are in a situation where they have an unplanned pregnancy So what this program does is it allows them the financial support to be able to continue and finish high school. It also encourages them to look beyond that and look for post-secondary education, because the idea is that the more educated they are, the better that they do in life, the better the situation is going to be for themselves and for this child. So they want to move them out of a situation where they are dependent on government assistance and be able to be independent and continue on and be in a better environment. Because in the end, we all win when that happens. Support is given in high school and in community service centers. Denver Health and Hospital Authority Women's Outreach Program is also using social media to promote these messages. That's going to be very key. Also, again, it's getting information out there. Social media, we know, is something that teenagers are very involved in, so they're using that media outlet to get the word out to them. Civic leaders, community leaders, and parents are going to be very critical in getting the communication started. We want to be able to foster these teenagers and give them information in a very warm, loving, supporting environment. We don't want to be judgmental. We don't want to lecture them. We want to be able to just provide them with information. Now, from there, parents definitely are going to impact and influence the decisions that they make. There's going to be moral values that need to be discussed with them. So the idea of a quality sex education program and being a little more aggressive with them is not to bypass those moral values. It's simply to get the communication out there to these teenagers. And it is about opening those lines of communications with educators, civic leaders, parents, so that they make better choices. So the key to all of this is giving them information, giving them the resources and the support that they need. When we all stick together and when we all work toward a common goal, we can do anything that we want to do. And it has been proven that as long as we give them that information, teenagers respond to it. They listen to it more than we think. Parents are still the number one influence in a teenager's life. So let's talk to them about the information they need. Let's get them the resources they need. And once we do this, our teenage pregnancy rates will go down, and we will all benefit from that. Let's put that money into post-secondary education, into other types of positive programs, so that we can continue to thrive as a nation. Thank you.